I'm Dr. Moshe Roth. I practice in family eye care in Old Bridge, New Jersey. I'm a developmental optometrist and also a neuro-optometrist. In this video, I'd like to explain what is phototherapy and how does it work. Phototherapy uses specific light frequencies and wavelengths, we call those colors, in order to improve specific centers in the brain that regulate neurochemical and hormonal and electrical balance. These centers regulate and affect how we use our body. The retina, which is the back part of the eye, is actually part of the brain. A large part of the brain is involved in vision and in coordinating vision with the other senses, including balance and hearing and proprioception. The direct connection between the eye and the brain is the reason that the light therapy through the visual system is so effective in changing how your brain functions. Syntonic light therapy uses frequencies of colored light to help restore balance in the body's sympathetic and parasympathetic nervous system. Let me explain a little bit more about what that means. The autonomic nervous system is also called the involuntary nervous system. And that's part of the brain that enables us to do things automatically without having to think about it, like your heart rate and your breathing. And it's divided into two parts, the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is for fight or flight, okay? And it kind of kicks in when you're in a stressful situation, like trying to stop a car on ice, or if somebody is threatening and they're coming towards you, okay? You have to make a split-second decision as to what do I need to do in order to solve this situation. So physiologically, what happens is the pupils, the black part of the eye, gets bigger. And the reason for that is it allows more light to come in. And your eyes diverge in order to bring in more visual information. The lens in the eye that normally helps us focus at things up close now dilates. So it doesn't focus on things up close, so you can get more information from the outside world. Your pulse goes up. Your blood pressure and your blood sugar levels go up. The parasympathetic nervous system is for rest and digest. It controls how you are normally in a non-stressful situation, and that's called homeostasis. Here, your pupils can get smaller. You can focus on things at near, for example, for reading or seeing the computer. Your eyes can point in toward each other so that it makes it easier for you to read or to see a screen. Your blood pressure and your blood sugar goes down. Light focuses onto the back part of the eye, the retina, and then it goes into the optic nerve, and then ultimately into the brain. The retina, again, is brain tissue, and that's why light therapy is so effective. Dr. Harry Riley Spittler explained these pathways in the Syntonic Principle, the book that he wrote. And in that book, he discusses how light sent through the retina changes the physiology of different parts of the brain, the thalamus, the hypothalamus, and the pituitary gland. Certain frequencies of colored light stimulate specific areas and affect different parts of the nervous system. Red and orange are lower energy or longer wavelength colors. They stimulate the sympathetic nervous system to improve fusion, meaning how the two eyes work together as a team, and binocularity. Blue or violet are higher energy or shorter wavelengths. They stimulate the parasympathetic nervous system. And these colors can help to reduce adrenaline, and that reduces anxiety and stress. Green and yellow are wavelengths in the middle frequencies, and they're physiological stabilizers and detoxifiers for chronic, meaning long-term, or degenerative health issues. Syntonic phototherapy is done primarily at home, and patients who see us for this therapy are usually seen each week during the therapy course. Patients wear specifically prescribed colored filter goggles while looking at a light source for about 15 to 20 minutes per session, about 4 to 6 times per week. And they're looking at that for about 15 to 20 minutes per session. At times, syntonic phototherapy is done as a single, standalone treatment, but it's often combined with vision therapy to reinforce and maintain long-term benefits. When used in conjunction with vision therapy, the results are usually more effective and they happen faster. And at times, syntonic phototherapy works to speed up vision therapy and to reduce the amount of time that somebody's in therapy. I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. I'm a developmental optometrist and a neuro-optometrist. Thanks so much for listening.